Brian Rudkin, One Sustainable Health for All Foundation, One Europe for Global Health Coordinator. We organized an event, Benoit mentioned it, during the World Health Summit at the French Embassy in Berlin on One Digital Health. And one of the issues was getting people to share data. It's very difficult to get sharing of data across the hallway in some institutions, let alone across the street, and let's not talk about countries. So Jai Ganesh Udayan Sankaran, Executive Director of Asia eHealth Information Network in India, shared with us how he was able to get not one, not three, 15 countries to share essential data. And it was absolutely, he gave us a roadmap on how to do that. And he will be sharing that through our network. And just a comment, it is possible, not easy, but it is possible. You just have to work with people and, as you say, show them what the carrot is by doing so. We also had in Fiocruz, a very major foundation in Brazil, saying, oh, you telling us, the global north, that data is very difficult to get in the global south? Well, that's wrong. We have data, essential health data, climate data, environment data on where people are living for over 120 million people. And by the way, we're putting it up to 200-something million next month. So they are very active and very clearly doing what you're saying, being able to bring in this data and then use it for AI analysis, for example, in a concerted manner. I just wanted to put in that call for statement of it is possible, people are doing it, let's get on the boat and make it happen. Thank you.
Thank you for sharing. We have a last question over there and then we'll keep going with this debate.
Thank you. It kind of goes back on the concept that people are talking about the last couple of questions. So people are talking about data, about reusability, etc. There are already a lot of these principles out there. For example, the FAIR principles, which have now also been taken into the EHDS, the European Health Data Space. So we're talking about integration and harmonization. We should talk about semantics. So what are we talking about? What do you mean with these types of data? It doesn't have to be shared. It can be visited. My data doesn't have to move from one country to the other because I have legal obligations in my country. It doesn't have to move there. You can move your analysis towards me. So these concepts are already out there. We just need to implement them. We just need to make the next step. So it's not about reinventing the wheel. It's looking at the wheels that we already have. So that's just my final comment. Thank you.
Actually, at the New York meeting tomorrow and the day after, there's this fair. The lady who's, Christine Kirkpatrick in San Francisco, she leads the fair thing. So they are doing, NIH is funding them for a great deal of promotion. There is a lot of legwork involved. You have to go from place to place and essentially sell your product. And it is getting done, and I think the scientific community is sort of being forced to realize, or realizing themselves, that it is in their benefit to share the data, because then you can get it from other people as well. And I think that is a very important carrot, that your data is not only being looked at by ecologists, but they are also being looked at by sociologists and by demographers. Why not? Suddenly your vision, your clientele, if you like, opens up enormously. That's a carrot.
We have also to say that when we now publish a paper, it is always written before the submission, how you will be, how your data will be made available to the readers, and you have to state that how, even if you write upon request by email, but you have to state that. So that's an interesting, good news also.